Hello, everyone, and welcome to today's discussion. Our topic for today is going to be titled Leadership During COVID-19, Anecdotes of Distributed Leadership, the QHSC Story. And to discuss with us this story, we have with us the distinguished healthcare guru, Dr. Harrieth Gabone-Mwalupindi, who is a professor at South University. She has a PhD in nursing education. She's been involved in healthcare for quite some time, and I'll let her kind of introduce herself in a second. While working with the QHSC organization, or Dr. Gabone's QHSC organization, I realized that there were many aspects of leadership that I had been studying that she and the organization were applying, especially during this time of the COVID-19 pandemic. So, Dr. Gabone, if you could, can you please at least just give us a brief summary of the Dr. Gabone Quality Healthcare Solutions and Consulting organization?
First of all, before I can say anything, I just want to say thank you for inviting me and take the time to come and have this conversation with you. So I've been a nurse for almost 20 years, and I have worked in majority of the areas in nursing, and the main part in my expertise are in obstetric. So I've been working with pregnant women, newborn, and children now. And currently I'm teaching at South University here in Florida at West Palm Beach campus. And on top of that, I am the founder and president of QHSC. And so the whole organization name is a non-profit organization, which is called Dr. Gabone QHSC. QHSC is Quality Healthcare Solution and Consulting. And that is based on doing the volunteer work and training of healthcare professionals here in the United States and abroad, specifically in Tanzania.
Thank you. Now, also, I know that one of the cornerstones of the organization is the medical mission to the Dodoma Medical Center in Dodoma, Tanzania. And you had a trip, or have a trip planned for the 2020 year. How has COVID-19 impacted the medical mission to Tanzania for 2020?
So I'll just, before I answer that, I will give you a little brief for my organization and volunteer work. So this will be the second year when I'm gonna be taking a group with us. Last year was the first time, but before that I was doing by myself. So in an effort to collect an expertise here to take them to Tanzania and go and work with me, we were planning a trip in September of this year. And usually preparation includes making sure you get the qualified individuals, make sure that all their credentials are correct, and prepare with the hosting hospital, Dodoma Medical Center Trust Hospital, to make sure that our professionals are well prepared and they know what they're going to do over there. So preparation have started, and I've started recruiting few expertise. Unfortunately, when COVID came, so when COVID started, we had to revise our mission and things that we were planning to go and do in September. We have to redirect our effort and try to use technology to help us, because people in Tanzania still need that services. So we decided to go through Zoom and use the technology to deliver that same care that we should have delivered when we go to September.
Okay, so when the pandemic struck, did you have any idea initially of how you would respond to the pandemic, knowing that the medical mission would probably have to be canceled?
So when the COVID-19, of course, approaching United States, and so we had to rethink. In the beginning, we did not cancel the trip because we did not know how bad it's going to get. So we still continue collecting supplies and donation from individuals who usually help our organization, still recruiting people. So once the numbers started getting a little bit more than we wanted, and realizing now also the COVID started showing up in Tanzania, we, for the safety of my volunteer and all the experts who have wanted to go to Tanzania, I had to postpone the trip because I want to make sure when I take them there, I want their health and their safety is my priority. So I have to make sure I take the group and take responsibility of them being safe, providing their care and come home safely. So when we knew the
Excellent.
COVID was getting out of hand, being at the level of pandemic, so we had to postpone the trip until next time.
Okay, so and basically today's discussion, we're going to deal with three aspects of leadership. One is going to be team leadership. The other will be remote leadership or long distance leadership, and also adaptive leadership. So we're going to deal with those three aspects of the organization and how you have been able to apply these, I would say, distributed or democratic leadership principles within the QHSC organization. So we're going to start with team leadership. So how is it that you came up with the next conference, which you're about to hold on Zoom, which is entitled Professionalism, keeping in mind the theme of team leadership?
So when COVID started, and we knew that we have to hold our trip or postpone our trip, and when that trip we had already things that we were supposed to go and teach in Tanzania, and realizing that we were not going to be able to do or to deliver that education or training in person, we had to move to using the technology and helping us. So with that in mind, I do have board members in the organization, and we have QHSC volunteers. So we had to discuss and come up with there was a lot of suggestions and how to try and reach the other side even without going over there. So we have to come up with different topics that are relevant at that time of COVID-19 as related to professionalism, clinical competencies, and accountability for the nurses. Yeah, so when we realized that we could not physically deliver the services that we were planning to, like training or education or volunteer work to the community. So as a group, QHSC board members and some volunteers members, we discuss and focus on the relevant topic, which was COVID-19 and how it impacts our healthcare delivery. So knowing those are the topic at that moment, and since we didn't have that much information about COVID and how it is going to impact our healthcare, we had at least a glimpse of how it was affecting here in America, and we can see how healthcare in America was turned upside down, and people had to adapt to how to deliver care, effective care, with all the challenges that were happening right there. So like having all these limited supplies or limited knowledge of how to deliver care for this patient. So discussion from the board members and volunteers, there was a lot of suggestion about the topics, and some of the topics are definitely was addressing COVID-19 and how we are going to share that information with people in Tanzania or healthcare workers in Tanzania.
Right, and you've already held numerous conferences already on Zoom. What were some of those topics that you had prior to the one that's coming up this weekend of professionalism?
So I think in the beginning we wanted to, as I said, we didn't know much about COVID. We knew it was an infectious disease, yes, but we didn't know exactly what are the symptoms, although with the guidance of CDC, World Health Organization, and the local officials, they were giving us symptoms as we learn. So one of our first conference was like, what is COVID and how does it, how can we prepare for COVID for the healthcare workers? So because our organization is majority of the goals or majority of the guidance, they are related to training and educating healthcare workers. So yes, we were thinking of how is the healthcare worker going to identify the patient with COVID? How can they be protect themselves? What skills are they needed to have in order to be able to take care of those patients? So that was one of the conference. Okay, so the second conference was about PPE, how safe and how to put those PPEs. And since that include demonstration or role playing. So during the conference, we had some of the nurses here from United States and some of the nurses in Tanzania had to demonstrate exactly how to put on the PPE. So we did that conference and it was able to share that recording afterwards. So all the healthcare workers can share that information. The third one was for medication. So we knew that yes, the nurses know how to at least have an idea how to identify those patients. Then the second one was how to put on the PPEs correctly and how to protect themselves, whether they're at work and going home or coming from home. And then the third one was for medication now, because there was a lot of discussion about what type of medication should be used. So we wanted to make sure the nurses and the doctors in Tanzania are aware of those protocols that are being practice here in the United States and Canada. So we had the expertise from Canada and the United Kingdom to come and share the experiences. So for the Tanzanian healthcare workers can learn from that. Because by that time in Tanzania, it was starting. So we want to make sure the healthcare workers are ready. And then so looking at the United States, how the pandemic was towards the, in the middle of the May, that's where we had the highest number, the fastest spread of the disease. We start seeing the nurses and the doctors are affected with seeing a lot of people are dying. So that prompted the topic of crisis intervention. So we wanted to make sure to provide coping mechanism for the healthcare workers when they're going to work, how they come home, how do they deal with it and still going back to work, and how are they going to deal with their family member when they go back home, worried about their disease, being infected. So we did that conference while we are sharing with the people from Tanzania, because yes, even if the Tanzania has not reached to that level that affected in the United States, but still nurses also can learn how to mentally be prepared and work in those stressful situations. Hopefully they will learn some coping mechanism, how to prepare themselves and be ready if those situations arise. And we pray that it will never arrive to that.
Excellent.
And then so from that, we at a point that now, or at least we've create basic understanding of how to care for patients during COVID. Now we need to go back to basic nursing or basic healthcare worker. What's the reason we decided to go to nursing, or why the doctors chose to be doctors? So we are going to do another conference which is titled Culture of Safety, which is those culture of safety. By creating that culture of safety, you have to cover professionalism, accountability, communication, teamwork, and competence. So that's the topic that we're going to discuss on the June 6th conference. And this is still a global conference. We have speakers from Norway, United Kingdom, Tanzania, and United States. So we are trying to make sure things that to share best practice between these countries. So all those are addressed in that day.
Okay, and might I add that those principles of the culture that you are suggesting there, that those principles are found throughout quality leadership, be it team leadership, collaborative leadership, adaptive or agile leadership. Those are also pillars of the same thing. So when you talk about professionalism and teamwork, can you kind of give us an example of how that might play out in a healthcare or medical environment?
So when we have all those goals or guiding principles in working in the healthcare environment, sometimes those they might be mixing up. When you're accomplishing one, you might be even demonstrating the second one. So for professionalism, I would give an example. For example, as a nurse, in order for me to be behave with a professionalism, I have to believe that the care I'm providing to the patients, how I carry myself in front of the patient, or during the care I'm giving to the patient, it has to be at the utmost best, in a sense that I have to be honest with the patient, I have to tell them the truth, and I have to value their presence for me to be able to provide care for them. So professionalism means I have to be prepared to go to work, means I have to take accountability also to know what I'm doing when I'm taking care of these patients. So I cannot just show up with work without thinking what exactly. I cannot show up with clothes that are not appropriate for the area. So as a nurse, for example, presentation has to be important. We wear scrubs at work, so I have to be professional for work. So if I see a patient, then I'm presenting myself at a professional way.
And how about collaborating with other healthcare professionals?
So majority of the time when you work in the hospital, you work in the teams. And so when you are attending to patients, you cannot do the care by myself. So the same thing that if we're talking a topic about the nurses, definitely you are not going to leave the physician, our colleagues, physicians out, because the nurse cannot function by themselves, or even the physician cannot function by himself. So when you're taking care of the patient, or we always call it plan of care, so those are the things that you collaborate around between the nurses, the doctors, and different disciplines to try and attend the patient's need. So if, for example, if a patient needs surgery and there's a concern, maybe there's not appointment for patient to have surgeries, or there's other things that the patient might not be able to get to surgery, maybe another discipline have to come and talk to them, or maybe this is a terminal illness. So all those things, when I was at the bedside, we used to collaborate different disciplines to try and achieve patients' needs and be able to explain all those things. So we have to have more than one discipline to be able to address patients' needs.
Outstanding. Okay, so now here's another question. Like I said, I have volunteered with QHSC, and I am kind of familiar with this, and that's why, like I said, this is why these things stood out to me. Would you say that the organization is actually now busier during the time of COVID-19 than it was before the pandemic?
Yes. So remember, as an organization, we had things that were planned to be done throughout the year. And as I said, you started planning for the trip since almost the end of last year, in November, December, for a trip that we're going to go in September. So in February and March, that's the time we realized COVID came. So a lot of things has changed. So we had to jump up and use that opportunity to use technology to try and disseminate the training or education. So that added another part that we did not plan from the beginning, because we knew we were going to be doing that area of education later on, while we are trying to put maybe once a month or once every other month for education purposes. But because of COVID, we could not do physical training or physical education. So that brought more work, in a sense that we have to prepare and try and hold these conferences or discussion to try and find more of the expertise who are willing to come and join our organization, or we have to collaborate with different organizations to make sure we deliver this much needed education, because that was almost a matter of life and death, in a sense that if we have the knowledge and we don't share with another healthcare worker who need that knowledge, and that healthcare worker can't go and get into trouble because they did not know, that is not fair. If we can help, we need to help now. So there's a lot of work behind the scenes going on, preparing for the conferences, preparing for the discussion, to make sure we deliver on what we believe from our medical mission, that if we can provide education and it reach the end user, who is a vulnerable person who might not otherwise get that knowledge, we have to do it and get it there. So yes, a lot of work has come up, and but it's okay. We're up to it.
And I would say team leadership, agile leadership, adaptive leadership, distributed leadership, collaborative leadership. They're known for their ability to deal with disruptive or dynamic factors that can impact an industry or an organization. And I would say that due to the dynamic crisis that has occurred, dynamic leadership has evolved from it on your behalf and the organization of QHSC. How has the pandemic or COVID-19 impacted board members in terms of their activity with the organization?
So I would say we are still young in our organization in the sense that we are still doing things, but in a normal rate or normal pace. And then so when the COVID came, and then it puts a little bit the challenge of and the requirement for either extra meetings or extra conversation with board members to try and collaborate quickly, make the decision very quickly to try and adapt to the demanding needs of the healthcare education and training in Tanzania. So that, yeah, so as I said, when we were planning throughout the year, the pace was okay, just because we have things planned up once a month or quarterly meetings and stuff, and we knew things were going to be okay, and we're planning for a medical trip ahead of time. But when COVID came and everything has to be done quickly, a lot of decision for organization has to be done quickly in a fast pace. So communication became a little bit an urgent matter in the sense that we have to communicate maybe either for WhatsApp as a group to be able to reach everybody else in time to get the response quickly versus waiting for quarterly meetings. So those are the things that we have to make sure our members had to participate in a sense that to make those decisions on the go. So some of the meetings were done one-on-one to try and get the members involved, and some of the meetings were done in collaboratively in a sense that we send a message as a group and we start communicate a little bit more than previous when we were doing maybe once every 4 months.
Okay, and then also with the increase in organizational activities, and we'll get into that in a second, how has that impacted membership as well for the organization?
So as I said earlier, the organization is still growing. And then so we started with very few members, including board members, of course. And then so while we are addressing COVID-19 and while we were asking to deliver this knowledge or education very quickly, we realized that if we continue with the same number of members, it's not going to be enough. We have to actively start recruiting more people so to try and help meet this demand. So asking volunteer in some of the conferences, try to give them the website number out so people can join in and try to take ownership, try to take part in the organization. So we do have, I mean, there's a growing number slowly. Within, I think, this month of May, we started announcing we had almost like 4 other specific people who are joining and they want to participate, for example, to give some of the education and training. So that helps relieve some of the stress from the only initial board members or initial members who were giving those presentation. And then still for the month of June also, we are still getting more people and a lot of people are subscribing now on the website. We're trying to, at least with every encounter we have in conferences, we're announcing that we need to recruit more new members because we know the more people you have, the easier it's going to get and the more impactful it's going to be to reach the end user that we are targeting from the beginning.
And what about the variety of volunteers in terms of professions? Are all of them healthcare workers, or what would you say?
No, in fact, even our for example, we started with board members. We do have board members for both sides of the organization, because there's one branch here in the United States, another branch is in Tanzania. So let's start in United States. So there's half and half. So for example, one of them is the engineer, another one is the healthcare administration, not necessarily that in the nursing part. And then for the part of, for Tanzania, another one is an auditor, another one is used to be a banker and she retired. So we do welcome a lot of members. And then so for members now, we're recruiting now, not necessarily they're all nurses, but majority of them work with the healthcare people. And then so it's globally now, we have members. We have members from Norway, we have members from Tanzania, we have a member for UK, and of course here in the United States. So we do encourage people, anybody who is willing to volunteer, and then we can try to find a lot of stuff. And so we're getting even more subscribers, different from different countries, some of them like from Sudan. So we welcome anybody who is interested to come and volunteer and work with us, and we find something for them to do. Because we're not only doing healthcare stuff, we're also doing things in the community. So all this outreach in the community, we welcome anybody who is willing. So that is a biggest criteria, that somebody who is willing to put time and help the other person. And that's what we want that person to come in with us.
Okay. And so what would be some of the titles of some of the newer members that have joined professionally?
So some of the experts who came to first of all present in the conferences, they have, they're doctors, nurses, and some of them are president of Tanzanian Nurses Association and midwives. And then so they're directors from different locations in Tanzania. There are nurses from Norway, as I said, the nurses from Australia, and there's some nurses from Tanzania, and some of them are doing some research in different areas of the country. So we have a diverse group, and we're still continuing recruiting a lot of people. So anybody who is willing to work with us and volunteer, we welcome.
Right. And I think that's a principle of, let's say, adaptive leadership. That's where you look to the community and you see what the needs of the community are, and you get feedback from members of that community, be them healthcare professionals, and you respond to that need. And I think the fact that you did that is something that motivated a lot of other healthcare professionals to come on board and to participate and to help get the word out, or to help promote the training that was going to be necessary for them to be prepared, or to help Tanzanians prepare for COVID-19. What were some of the other things that you did? I know that there was some fundraising, and then there was some outreach here in the United States as well as in Tanzania.
Before I answer that one, I think I forgot to mention that for the inclusion, we try to include a lot of people from different fields, and I appreciate all their help, because at least they help me think in a way that instead of just focus on healthcare things, they make me see healthcare from outside. So it's always easier for me to think of healthcare because I've worked for 20 years. But it's always an amazing for me when I'm explaining healthcare worker for someone who is a non-healthcare worker. And then so to hear their impact or understanding of healthcare work, it gives me an option to expand my knowledge and be able to include a lot of things that we will be doing for communities. So I'm always grateful for anybody who is not in healthcare worker and joining us, our team. Okay, so with that, we do have new members, and we had to, including also students who comes and excited, they want to be able to do volunteer. And so we are grateful that even the student, nursing student, who wants to come and volunteer. So for this year as an organization, we were able to do at least 2 things, even including with this impact of COVID. So some of our nurses, also one of our board members also works in New York. For this year, even with COVID restrictions and limited resources, we had the call from New York nurses and doctors, in fact, including healthcare workers of New York. They were struggling to find or to get PPE to work. And so we as an organization decided to raise funds, and so we put the different venue to raise funds, either through our website, GoFundMe, and through Cash App, and we were able to raise enough money to buy some N95 to help the healthcare workers in New York. And this involved the people who are recipients, with nurses, doctors, the secretary, the housekeeper on that unit that it was heavily taking care of patients with COVID. And so that was the smallest thing that we can do for them, at least to contribute for their safety. And we were able to donate those masks, and they were very, very appreciative. And we are glad that we were able to provide that support for them. And on the other side, on the global side, we also, as an organization, we wanted to go and do the same thing for fellow Tanzanian and try and raise funds here and go and help them. Because the resources were limited, and the surgical mask N95 were limited in Tanzania, and it was very hard to get them here and ship over there. So we decided to do the second best thing, which was to donate the money and collaborate with one of the organizations called Magnet Youth Organization Sports, and Dr. Beverly Cheremin, and we raised also more funds over there and be able to buy the cloth and get the tailors from Tanzania and made those masks, cloth masks, for the one of the pediatric unit in Tanzania. And those children are very compromised because they're already sick. And then so getting this, preventing them to get this coronavirus was one of our priorities. And we know that if the children are sick, also the healthcare workers are right there with them. So since we couldn't get the N95 or mask to help the healthcare worker, we did the best thing to cover these children. At least they will protect them when they're coughing or sneezing, at least protecting the healthcare workers who are working in that unit, because you never know with this COVID. At least we wanted to protect the healthcare workers and protect those children at that hospital. We were grateful that we had the chance to donate those almost 2,000 masks, 2,000 cloth masks that were made by Tanzania and then donated to that hospital. So we are grateful for all the people who donated during those two fundraising, and we're asking for more money so we can help other people.
Excellent, excellent. Now let's just touch on the actually the last part here, which is of course adaptive leadership. And adaptive leadership looks to the community or society to ask them and to allow them to come up with ideas and solutions. And how would you say that within your organization, how is it being, how are you getting information about reaching out to the more rural areas of Tanzania where there may be a language, not a language barrier, because most of the presentations have been both in English and in Swahili. So there's not a language barrier, but there is more of a focus on the native language, which is Swahili, as opposed to English. And then also understanding that that is also something that some of the members and volunteers and participants in the conference find important. So how does that drive your organization for future programs?
So because one of the main goals for the organization is to try and, yes, train medical and healthcare workers, and also do the community outreach, because we do believe that if the community is healthy, then healthcare workers have a better chance of taking care of only people who are acutely ill versus chronic. And if the community is healthy, also the chronic disease will be low in the community. So with this pandemic and the inability of us to go to the mission in September, we, as an organization, we've been communicating with leadership over there in Tanzania, and we're still communicating with the district and the rural regions in Tanzania to try and collaborate or try and find any possibility that we can have to reach people who are beyond the big cities. We want people who are in the village. So we are trying to find ways that we can sustain our education, and then so they can gain that education over there in the village. So yes, the language is not an issue. If we were there physically, of course, we can educate them in Swahili, and a lot of our colleagues, nurses or doctors over there, then we can communicate without any problem. But with these restrictions of the COVID or traveling or even inability of us to go with mission, so using this contact or networking, and we try to communicate regularly with the leadership on Tanzania, and we try to create or building network to be able to reach even the person who not necessarily that they will see us on the conferences, but at least they will get our message when once we finish creating it, and then so they can get and use it on their daily their job. We are working in the with a different level of leadership in Tanzania. Like some of them are in the city, some of them are in the regions or district, and then also I know there's a possibility of using apps. So we are still working on trying to develop some means that we can deliver our messages or training that way to the end user in the village to be able to get that information, whether it's in English or whether it's in Swahili, whatever the language they need, then we do. And then communicating with those leadership, they will tell us what exactly their needs are, and then so we can create or prepare things that will be able to help them, and then for them to improve their clinical practice and create this culture of safety for their patients.
Okay, and one last thing is when you reach out to those in the more rural areas, you may reach out to them, let's say, on a particular topic or for a particular instance. And then I believe what you mentioned was the objective is to also guide them to the website and also to the YouTube page, because it serves also as a professional repository. Can you speak a little bit to that, please?
Yeah, so that's the part. So a lot of things are working in tangent. So we have, yes, these conferences or discussions, we are creating this educational material, and you are relaying them, or you are giving them through the conferences or the discussion or the videos. Okay, so when we were creating this content during the conferences or discussion, and so we have an opportunity to build a bank, means like a resource bank, so they can come and get different training or education for different things. So the way we do that on the website, we are creating a page that we have all the list of the things that we have developed or trained, anything that we develop or we created for training purposes, it's going to be in there. We also link in our YouTube channel. So once you go there and search Dr. Harrieth Gabone, you will see the QHSC channel, which has all the list of the videos of all the conferences, on all the discussion, all the demonstration or the skills-based demonstration videos. They're right there, so people will be able to have an access, and they will use those the YouTube channel and the website as a resource for education. And we are talking about with the leadership in Tanzania, different hospitals, to be able to use those resources for when they're doing the training for the new nurses or training for quarterly training. So we are still in the discussion to be able to do that. And on top of that, we are working to try and make sure whatever the education we're disseminating, we want to be able eventually people to get the CEs or continue education, to try and that they can use those certificates to say that they have received those training and then be expected to be able to perform those skills they've gained. So we are in the process of doing all these things, and so keep tuned and come back and see us.
Okay, and then I forgot one more thing that I think is really, really excellent here. You talked about outreach in Tanzania and the unit that you donated masks to for the children, but there was one other thing which you did just recently with one of the QHSC board members that involve children as well, and sports. Could you just tell us about that quickly, and then we'll end?
So yes, thank you for reminding me. So there was one conference that I did. I was honored to be asked to be able to provide nutrition and health related to the Magnet Youth Sports Organization, where there's of youth from 6 years old to 17. And then so they wanted me to come and discuss on the last Sunday, I was asked to participate in workshop with Magnet Youth Sports Organization, which it's training the youth with the soccer, or we call it soccer in America, but in Tanzania they call it football. And then so these are the boys and girls from the age of, I believe, 6 to 17. But the ones I was talking to, they were from 8 to 17 years old. So because they've been home for a while with this COVID, so the children have been like doing some little exercise at home and try to wait until when the COVID restrictions are lifted, so then they can go back and practice. So the coach and the leadership for that organization, they wanted me to go and talk to the children to try and just prepare them to go back to, once they're allowed to go back to school and go back to this club to practice. And they wanted to know health-wise, what are the things that they need to do to protect themselves when they go back to doing these contact sports and all these social distance restrictions. What are the things that they need to do about hand washing? What are the things they need to do about protecting themselves and knowing if they have symptoms, what should they do? And the second part was for the nutrition. So these children need to know that in order to be an athlete, and you have to be able to eat healthy. Then yes, so there's a variation there when we said healthy, because it's also supported, like how much can you afford. So there's some people who can afford all the nutritional needed food, and there's some people who cannot afford, but they can have at least some substitute. So that's the part which I went and be able to discuss the health part of it and the nutritional side of it, of raising a child in athletic world. And so we were able to mirror those, marry those two things and to talk to the children. And there are about 45 children there, and they are very, very talkative, and it was a very good day. But it was, I give credit to the Magnet Youth Sports Organization leadership, because of seeing that the children's, the sportsmanship also can be supported with the health of the child and the nutritional value. And the parents who were there also to be able to support their kids. So it was a very good conference, and I'll be happy to do that again, because those children inspired me to be able to say, yes, you know, we can think outside the box and try to help and raise a healthy generation. So that was very good.
So, in terms of long distance leadership or remote leadership, what advice would you give to any non-for-profit or community based organization at this time as it relates to long distance leadership and remote leadership, being that I know you have gained a lot more of experience in that area?
Yes, so it's, I would say, yes, there's a lot of things to learn, and I'm still learning. And I'm surrounded with a lot of people who have knowledge about the long distance leadership or remote leadership. And I thank you for the opportunity to discuss some of the books and stuff. So that is helpful. So what I've learned is, at least so far, I say leading from far or leading from a distance. So we have to be creative on times. We have to be effective on what the message we are sending. We have to inspire people who are far away to see on your vision, to be able to come and join you on that journey. So try recruiting people, trying to engage people, try to show the value of organization. It requires a lot. And so leading from far away, or leading from distance or remote leadership requires a lot of contact. I mean, you have to keep people engaged and asking people, get them involved, let them participate in things that they're interested in. So sharing that vision, sharing that passion, or sharing that fire to continue doing the work of the mission. So it is challenging. So I'll say for any non-for-profit organization, when you're leading remotely, it is just try to be engaged with your members or active members, or to try and inspire them and try to include them so they feel like they're part of the organization. And then you have to be able to inspire people and give people a chance to show you what they can do, and then appreciate what they do for you. So I always appreciate for the advice, and we keep learning.
Thank you very much. On this leadership topic or discussion that we've had today with the illustrious Dr. Harrieth Gabone-Mwalupindi, President and founder of Quality Healthcare Solutions and Consulting, otherwise known as QHSC. We thank you for your efforts, all that the organization has done for your help here in the United States, as well as in Tanzania, and galvanizing members throughout the diaspora as well to contribute to the efforts to try and keep, I would say, everyone healthy and safe. Thank you very much, Doctor.
Thank you for your time. Thanks.